Hello, my name is Ashley Booth. I am a student at Nightingale College. Today I will be performing the insertion and discontinuation of an IV. So first, prior to getting started, I will ensure that I have all of my supplies ready. I have my IV start kit, I have my extension set, I have my 10 ml syringe that I'm going to flush the vein with, as well as my 22 gauge needle. I'm using a 22 gauge needle today because I do have an older patient. With older patients, their veins tend to be more frail, so we do want to err on the side of caution and use a smaller gauge needle. I also have my sharps container here. So prior to beginning my procedure, I will go ahead and wash my hands. This is after I have ensured that all of my equipment is on a bedside table with a barrier, so that it is as sterile as it can be going into the patient. So I will wash my hands, I will don my gloves. My kit did not come with gloves, so I will be simulating that today. I will go ahead and open my IV start kit. Okay, so I have my tape, I have my tourniquet that I will place next to my patient. Okay. I have my tape, and then I have gauze and my alcohol wipe. Okay, I will be using an alcohol wipe today. You do have the option to use a chlorhexidine wipe as well. So prior to beginning, I'm gonna go ahead and remove my extension set from the packaging. Both ends are secured right now. What I'm gonna do is I'm going to open my 10 ml syringe, ensure that there is no air in the syringe, and then I'm going to attach it to the extension set. And then I'm going to flush it to ensure that there's no air and no bubbles, okay? So that is good for now. We will place that off to the side. Now I'm gonna go ahead and palpate for a vein. Okay, I feel a very good bouncy vein right here. I will take my tourniquet and I will apply it 4 to 6 inches above the insertion site. So then I will take, once the tourniquet is applied, I will take my alcohol wipe and I will begin at the inner portion of where I'm going to insert to the outer portion in circular motions. I will let that air dry for about 20 seconds. I will then remove my IV and I will make sure that prior to inserting, the bevel is up on the IV. Now that my site has dried, I will go ahead and pull the skin taut and I will insert the IV. I will be looking for blood return in the chamber. I see that I have blood return, so now I will retract the needle, throw that in my sharps container, and then now I will apply my extension set. Okay, connect that. That is secure. I will remove my tourniquet. And then I will go ahead and apply my sterile dressing here. All right, sterile dressing is on. The site is secured. Now I'm gonna go ahead and flush the vein to ensure patency, as well as to make sure the patient is not experiencing any pain. Okay, so I'm flushing the vein. Prior to flushing, I'm gonna pull back to ensure that I do have blood return. So I will pull back prior to flushing. I do see that there is blood in the syringe here. So now I will go ahead and continue with my flush. Excuse me. All right, and then now that that is flushed, I'm gonna go ahead and discontinue that. I will reapply my sterile cap. Okay, I'm gonna go ahead and lock the extension set so that there is no backflow. I will then take my tape and I'm gonna loop it around and then I will secure the site. Okay, the site is secured. My patient is not experiencing any type of pain. Everything looks good on my end here. Okay, so now for the next portion of my video, I will be going ahead and discontinuing the IV. The process is a little bit similar, except now we are going to be removing the IV. So first I'm going to gather my supplies. I do need 2x2 gauze for this exercise, and then I need tape as well. And sometimes, depending on the patient, you might need additional gauze. If they are on blood thinners, they do tend to bleed a little bit more. So I'm going to explain to the patient that their procedure's done. I'm going to go ahead and I'm going to remove the IV now. So first things first, I would wash my hands, don my gloves, make sure that my supplies are ready. So I have my 2x2 gauze here, and then I have my tape as well at the bedside. I will go ahead and first remove the tape that secured the extension set, toss that. Then I'm going to go ahead and remove the sterile dressing from the patient. And while I'm removing this dressing, I'm going to ensure that the IV is still stabilized in place. We don't want any unnecessary movement if we can help it. Okay, then I'm going to fold my 2x2 gauze over with the non-dominant hand. I'm going to place it directly over the insertion site, and then I'm going to pull the catheter out of the site. I will apply pressure to the site for about 20 seconds to ensure that there is no bleeding. And then I'm going to inspect my catheter hub, make sure that everything has come out of the patient and that it is in a good condition. I will then take this, discard this into my sharps, and then I will go ahead and secure the site with some tape after the 20 seconds has passed. Ensure that the site is taped securely to prevent any type of leakage from blood. And I will gather all my supplies, toss my supplies, and that is the end of my demonstration.